This is a part 4 video of the spinal cord. Here we are going to see only the clinical aspects of the spinal cord. For that, the student should know certain important things. Okay, first I am going to draw the spinal cord section, right? Okay, right. Number 1, here I have drawn the anteromedian fissure, right? Central canal I have drawn. Here I have drawn the posterior root ganglion and the nerve. Here also anterior root. Okay, this is spinal nerve, right? Here I have drawn everything. Already you know well that we have 4 important tracts: pain and temperature. It crosses here, pain and temperature. That is your spinothalamic tract, and this is the only tract which crosses. The tract which doesn't cross over here is your posterior column. It will not cross. It comes here and then it ascends up, so it will not cross. Okay, posterior column. This is the area called posterior column. Fasciculus gracilis and fasciculus cuneatus. Gracile for the lower limb and the lower trunk, and cuneatus for the upper limb and the upper trunk, right? Position, joint, vibration, sensations are going through that. And then number 1, next is the anterior horn. You have full of alpha and gamma motor neurons, right? Now my first clinical applied anatomy is your corticospinal tract is here. Anterior corticospinal tract, lateral corticospinal tract, reticulospinal tract, tectospinal and rubrospinal, vestibulospinal, everything is here. Okay. Here spinocerebellar anterior, posterior, anterior spinocerebellar and the spinothalamic tract. What is going here I have drawn here, right? Now the first applied anatomy is poliomyelitis. Poliomyelitis means it infects, the virus affects only the anterior horn. Anterior horn means I said motor. So the motor cells are all affected. So the particular limb, particular area, for example, if it is T2 level, the thoracic level will be affected, or if it is lumbar level, lumbar part of the spinal segment is affected. So that for example L3 L4 segment. L3 L4 segment means lower limb. So lower limb is affected. Motor means muscles. All the muscles are become atrophied. Atrophied means it is not, we are not able to use that. Okay, if you don't use the muscle, that is undergoing for atrophy. Atrophy means disuse atrophy. So the muscle will be very small. Okay, so that is called poliomyelitis. It affects the anterior horn. First over. And then number 2 is you have central canal dilatation. Central canal dilatation, that is called as dilatation. That is called as syringomyelia. Syringomyelia means the central canal will be dilated. If it is dilated, what is the tract crossing over here? Spinothalamic. So the spinothalamic tract will be affected. So the spinothalamic tract is affected means what will happen? Pain and temperature will be lost. So spinothalamic tract means pain and temperature, as well as the anterior spinothalamic we don't bother. Okay, pain and temperature will be lost. That is about syringomyelia. Number 3, very important thing called as complete cord transaction syndrome. Complete cord means what are the things will be affected? Here, this one, posterior column means position, joint, vibration will be affected on both the sides. Complete cord means everything will be affected. That is called complete cord transaction. That is complete cord transaction. Okay, so what are the effects? Position, joint, vibration, discriminated touch will be affected on both the sides, and pain and temperature, pressure and touch will be affected on both the sides. And then anterior corticospinal tract is affected on both the sides. So at the level means paralysis of the muscles. Okay, both the sides. And then extrapyramidal tracts, all these are called extrapyramidal tracts. The tectospinal, rubrospinal, everything is called as extrapyramidal tracts. If they are affected, it leads to spastic paralysis. Okay, spastic paralysis. So all the things will be affected. So this is about complete cord transaction. If the last thing is, all the examiners we want the students to write this one is called as Brown-Sequard syndrome. Brown-Sequard syndrome. It means hemisection of the cord. Hemisection of the cord. What is that hemisection of the cord? Okay, right? We'll see. Hemisection of the cord means only this part will be affected. Only we will use separate color. Okay, only this part will be affected. Hemisection of the card, one half of the card will be affected. So you tell me now, position joint, this is called posterior column. Posterior column means what are the sensation, position, joint, vibration, discriminative touch. These all will be affected on same side or opposite side? Same side, because it has not yet crossed. So same side, position, joint, vibration is affected. What about the spinothalamic tract? It is crossed. So opposite side. So if it is right side position, joint, vibration and discriminative touch will be affected, and on the left side we'll be having the loss of pain and temperature. Understood? And corticospinal tract is crossed tract. It is a crossed one. Okay, so the motor neuron, corticospinal tract. So corticospinal is crossed, so you will be having paralysis on the opposite side. So here opposite side paralysis of the muscles. Understood? The extrapyramidal system is here. So this extrapyramidal system is affected. It is called as spastic paralysis. So again I repeat, number one, position, joint, vibration is lost on the same side, and the second is pain and temperature is lost on the opposite side, and paralysis of the at the level of the injury you have the paralysis of the muscles, and below the level of the injury you have spastic paralysis. So you have to write at the level you have the paralysis because of the corticospinal tract, because of the extrapyramidal tracts you have the spastic paralysis. Understood? The difference you should notice. So these are the components you should write. Along with that you should write one important thing, sympathetic fibers also going via that. So the sympathetic fibers are damaged, so it will lead to Horner syndrome. Okay, don't forget to write. So that's all about the hemisection of the card. So you have 4 applied: poliomyelitis, central card dilatation, stringomyelia, complete card transaction, and hemisection of the card. And the last one is anterior spinal artery syndrome. Already I have discussed. Anterior spinal means anterior 2/3 of the spinal cord alone will be affected. So who is escaped? Position, joint, vibration is escaped. So while writing the anterior spinal artery syndrome, please don't write the posterior column because it is not affected. Only this area will be affected. That is called as anterior spinal artery syndrome. So you can write 5 clinical applications in the spinal cord. Along with that you can write lumbar puncture. Lumbar puncture can be done at which level? L3, L4 level, because your spinal cord ends at the upper border of L1. So say L2 leave, L3 level, L4 level only you have to do the lumbar puncture. If there is any increased intracranial pressure, you are not supposed to do the lumbar puncture. If you do the lumbar puncture, in spite of the increased intracranial pressure, it may lead to tentorial herniation. Tentorial herniation. The tentorium cerebelli already you have seen, no? Through that your temporal lobe of the brain and the brainstem, everything will be coming because of the increased pressure. You are releasing the pressure from down. Okay, the lumbar level you are doing the lumbar puncture, you are releasing the pressure. Already pressure is very high in some tumors inside the skull, inside the cranial cavity. So without reducing the pressure of the cranium, if you do the lumbar puncture, all your brainstem structures will get stuck inside the tentorium cerebelli and the patient will die immediately. That is called tentorial herniation. That and all you can write. Lumbar puncture, tentorial herniation, everything. So minimum 6 clinical applications you can write. For that the student should know that pain and temperature fibers are crossing and position, joint, vibration are not crossed. These 2 facts if you know, you can write the clinical applications however whatever way they ask. Okay. So that's about the spinal cord clinical anatomy.